This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Today's Medical Minute is going to be on something that we actually saw a couple days ago, which I think is an interesting topic, and it's blunt cerebrovascular injury. So basically what that is patients in blunt trauma, and we're assessing if they have like a vascular injury to the arteries in their neck or brain. And, we usually do our trauma scans where we're doing non-con CTs of their head and their neck and then contrasted CTs of their chest, abdomen, and pelvis. But for these patients, we need to do a vascular study, an angio of their head and their neck to assess for these. And so there's a question of which patients need that. And so there are guidelines out there which help kind of answer that question. And so EAST is one of the premier kind of organizations that has established guidelines for this. And so they've set out the criteria, which are evidence-based, regarding which patients need to get angiography of their head and their neck who are in blunt traumas. And so their recommendations are that for patients that come in a blunt trauma that have an unexplained neurodeficit, they need to get an angio. Also, if they have a nosebleed that seems arterial, they also need one. And then the ones that I think are a little bit more sneaky and ones that we should definitely think about more is if they come in GCS less than 8, they should get an angio. If they have a suspected Petrous bone fracture, if they have a C-spine fracture. And so if you think about it, if there's enough force to fracture the bone, there's enough force to damage the vessels. And then if there is a small fracture at all through what's called the foramen transversarium, which is basically the foramina through which the vertebral arteries go through. Obviously, if that's damaged, then the arteries could be damaged as well. And then a LeFort fracture, type 2 or type 3. So if you have those are the patients that need to get angios. And then those injuries, they also have a grading system, just like a small intimal irregularity to a dissection to a pseudoaneurysm to also a complete transection. The former two, just an intimal irregularity or a slight dissection, those patients usually just get either on aspirin or get heparinized, while the ones who have pseudoaneurysms or transections or whatnot, those will need surgical intervention. So either way, just it's a slight thing that we have to think about is, who are the ones that need to get angiography, but those are some of the criteria for doing that.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.